Hi, I'm John Hamlin and welcome to WakeTV. The holidays are here and we've got a lot to show you. The winter months are traditionally a time when we get together with friends and family to celebrate, but COVID-19 is changing all of our plans this year. To help people learn how we can celebrate safely this year, Wake County recently launched a new initiative called Healthier Holidays. Our Stacy Beard sat down with Dr. Nicole Mushonga, Wake County's chief epidemiologist, for a conversation about how we can celebrate safely this year.
Hi, I'm Stacy Beard, and this is WakeTV. Well, 'tis the season for the holidays, right? The family gatherings, getting together, exchanging gifts, and likely also exchanging some germs. And that's not healthy. That's why we're here today wanting to talk about healthy holidays. And joining me is Dr. Nicole Mushonga. You are the Associate Medical Director for Wake County and the Epidemiology Program Director. Thanks for joining us.
Thank you, Stacy. Thanks for having me today.
Now, you probably feel like a broken record. I kind of do too. We've been talking about COVID-19 for months, right?
Absolutely.
And maybe we're getting a little fatigue, but we are headed into a critical time that this is when it's really actually most important to not get fatigued and to lapse into, I don't wear my mask.
Absolutely. This time of the year is a time that we are traditionally gathering with family and friends and oftentimes traveling. But this year it looks different. This year, we're not able to do those things. We can do it virtually, but doing that in person just has too much risk with the way that we're seeing our numbers increase and just the impact that that can have on our communities.
Now, I think there's many of us that get that, right? Myself personally, my dad's up in Jersey and my mother-in-law is down in Mississippi, and historically, we're going to one of those places. And this year, we're just not. My dad had a stroke and my mother-in-law has health issues. We just know, and my husband's a firefighter. It's just not, we're exposed and we don't want to risk losing them. And you know, I saw a headline recently. It was have large holiday gatherings, plan small funerals, you know, and that is my fear, is that that's what would follow, that I'd start 2021 with losing one of our parents because we just, you know, who knows? We just brought some extra element of risk into their lives when they're already high risk.
Absolutely. That is a concern of all of us in the health profession and in public health. We don't want to see that happening. Traditionally, my family is traveling to New Jersey and then up to Boston as well. That is our traditional Thanksgiving year. But this year, we're doing it at home. We're doing it at home with just myself and my husband and our kids. Yep. And we're going to do a virtual Thanksgiving. So invite everyone through different virtual methods so that you can still have that moment, still connect with them, but you're not posing that risk of being there in person.
Yes. And I actually talked with my brother yesterday, because normally I just call Dad on the phone, and because he's had a stroke, it's a little difficult for him to speak, so he doesn't normally say very much. And I said, oh my gosh, I didn't think about this. All this talk of virtual, you know, my brother is super savvy. He's got an Apple Watch. He's got all this. I was like, why aren't we talking to Dad on video? Let's get him on video. And so Thanksgiving, of course, my brothers, they don't know how to cook, so they're getting some glamorous meal, you know, brought in. And I'm like, well, let's see it. Let's share what you're eating and what we're eating and actually see Dad and not just do the phone call. And so I think that will make it, because I was just like, I can't just call Dad. That just seems like geez, it's going to be Christmas. But a phone call with a video, you know, that's the technology today. I don't know why we've never used it before, but now I think it will make my holidays more special because, that's what we're all doing today.
Absolutely. I mean, I think about our Thanksgiving, and typically the day after Thanksgiving is the time where we're decorating the tree and putting on the different ornaments and playing the Christmas music and really getting into the season. And this year we're going to have our iPads up and videoing with the family, and we can both take turns playing different music on our end and decorate the tree and kind of show it off. It's just, we have to reimagine things a bit. It's been difficult. It's been a long 9 months, and I think we all understand that, but it's so important that we don't let up just yet. We're so close to a vaccine and other things that can really help our community.
That's right. We're almost to the end, right? We're seeing positive things happening, and while we're so tired of these and the distance, just push through. And
Absolutely.
2021, I know we're gonna see more positive.
Absolutely.
I know that people think, okay, well, I've made it this far, right? We'll make it through Christmas. It's fine. We'll just keep doing the same thing we did. But I'm very nervous as you see the positivity. There's always this lag, right? Mm-hmm. You see the positivity rates go up, then the hospital rates follow right after, and then the deaths come. Mm-hmm. And we are at a peak right now. Mm-hmm. And I'm so afraid that those things are going to follow. And I think you feel like if you've gone this far and you don't know someone personally that's been lost by it, it's not going to happen to you. But I maybe was one of those people until back in September. Again, I said my husband's a firefighter, and I came to Wake County from Clayton, and we lost a firefighter. Mm-hmm. And we lost a spouse of a firefighter to COVID-19. And this was a guy who was younger than I am. Mm-hmm. And he came to work a shift. A couple days later, felt a little sick, stayed home. Then he was in the hospital, and in a month, he was gone. Mm-hmm. And 2 young children, and Jason was super safety. He was the safety conscious guy for the department. Mm-hmm. And to think that he's gone, and to talk to his wife about getting through Halloween and Thanksgiving without him, and thinking about Santa Claus, and that just makes it so real for me. And I think when I engage with people who maybe aren't doing some of the safer practices, I'm feeling more emboldened to share that I lost somebody, so can you please put your mask on? And normally at that, they are very responsive. But I think until you have that personally affect you, you don't think, right? Everybody thinks they're immune. And I want people to know it is very real. And the Dean family of Clayton wants people to know that it's very, very real. And that's what I hope people remember in the holidays when they think about grandma and they think about their families. It's just so important to know that this is taking people's lives.
Right. I'm very sorry to hear about your friend. And I, too, have a personal experience with loss to COVID. In April, as this pandemic was just sort of starting to peak within certain areas of our country, both my mother, my grandfather, and grandmother were all hospitalized with COVID-19 at the same time.
At the same time? At
the same time. Within a matter of weeks, they cycled sort of in and out of the hospital. And unfortunately, in mid-April, I lost my grandmother.
Oh, I'm so sorry.
My mother and my grandfather were able to recover and are doing well, but it's personal.
It is.
It's personal, and it's so important that people understand and that our community understands that this can impact anyone. It doesn't matter what you look like, where you're from. This is personal.
Yes.
And we all can do our part to prevent spreading this virus to others in our community.
Yeah. You do a lot of TV interviews. You've been working so hard to get the word out through the community. You just must feel like this is such a mission. I mean, to personally lose somebody and to hope that just one thing you say, sticks with someone. I don't know. Is there anything you'd want to share with people? Maybe the most important thing you think they should do, or one thing you would just ask them to do in honor of your family, in honor of Jason Dean,
Yes.
to hopefully help to not spread this.
Yes. Wear a mask.
Yeah.
Wear a mask. And right now, it's just not safe to gather with others. I know that is something that is traditionally done, but it's just, you don't want to have the same stories that we have.
You don't. You really don't.
They're not stories that you want to experience, and you don't have to. There are ways that you can be safe in the community. Keep the community safe. Keep your family safe. And I think we want to reiterate wearing a mask and not traveling for the holidays as the guidance is recommended, and staying within your household for Thanksgiving and even Christmas dinner. Use that time to build new traditions and new things with your family, and just to continue to keep them safe.
Yeah, we have to do that. We really have to do that. You kind of mentioned there is some hopeful news on the horizon. New testing. Now, Wake County has been doing amazing testing.
Yes.
I look at other counties around us, and it's wonderful to see that Wake County has these drive-up testings. They're soon going to have, indoor testing, and it's free.
Yes.
And we have people that will tweet back to us and say, well, this is like Chick-fil-A type, service. They know how to get you in and get you out. And I hope people are taking advantage of it, because that is, helping. If you and I could have COVID right now, we don't know it. There are people that just won't show the signs, and getting a test is one of the best ways to know, okay, I need to quarantine. I need to stay away from everybody.
So testing is so important within our community. Our 2 testing sites, they have been so busy testing so many people. And it's so important. When you go to our testing sites, they're drive-through testing sites. And so you're able to drive up in your car, and you don't have to get out of your car. And you can do the test, and there's instructions that you can follow. And they're having really great turnaround times as well.
Yes.
Early on in the pandemic, we were having to wait a long time for test results. But right at this point, we're able to really get results back quickly. So and that's important, because that allows us to then reach out and tell someone if they've tested positive that they need to isolate, and we can identify their contacts. And as we're able to do that, that slows the spread. It slows the transmission of the virus, because we can identify those that might be impacted. However, they don't have the opportunity to spread it unknowingly throughout the community. Right. So it's very important.
It is. And if people are interested in finding out about it, because we're also working to add more testing sites within communities that we're trying to reach. So people should just continually go wakegov.com/COVID-19, right? And they can go there. They can sign up. It takes a few minutes. You get a guaranteed slot.
Yes.
And it's very simple, as you described. So I hope people take advantage of that. It's nice to know that ahead of time.
Yes.
When you get that word that someone at work or someone at your school, and then I'll just go and sign up, and we'll have peace of mind, or we'll know we got to stick together and prevent someone else from getting this.
Absolutely. I think that's the main point, is just education and knowledge, knowing sort of where you stand, and knowing that, you have the resources to be able to isolate and to quarantine, because you have the knowledge of your test results to lead that. So
absolutely. And other good news, new testing ways. There are developing ways to test at home. If you get a prescription, you could just take it home and you'd find out in 30 minutes. Now, I don't think those are going to be widely available in Wake County right away, but it's encouraging to know that there are new methods of testing, and then also, obviously, that the vaccine is being worked on. And as you and I know, Wake County has been very busy working on our plan once a vaccine is approved on how to get that out to the community. That will likely be just as important as the testing has been.
Oh, yes, absolutely. It's so important that our team has had a small sort of focus group together that came together earlier in October and just started preparing and have been working through with each sort of new addition or things that we hear about the progress of the vaccines that are going to be available, and really tweaking that plan to fit our community so that when it's available, our county is able to respond.
And ready to do it. Yeah.
Absolutely.
Because that will hopefully be a game changer for all of us. If there are people that will, perhaps out of need, bring someone into their home from the immediate family for the holidays, because that's just, they do that every year, or they have to in terms of care. So I'm bringing grandmom over. I know myself personally, I've now trained myself, and my brain functions in the way that if I walk outside without a mask, I feel naked, right? Yes. But in my house, I'm not wearing a mask, but that is something important. If you are going to do what we don't recommend doing, but bring people into your home, it is important at home to be wearing a mask in that case. Right.
If people are gathering, and it's not recommended, but if they are bringing someone into the home, then everyone needs to wear a mask. I mean, if this is being done for Thanksgiving and for Thanksgiving dinner, there are recommendations to keep the tables 6 feet apart. Don't sit at one long table. Have that table separated, and open the windows. Increase airflow. That's something that's really important, that if you can increase the airflow within the space or the home, that helps. But also wearing the mask as you're inside your home. I know it's not something that we're used to doing. And as you said, if we leave the house, myself, my kids, the mask is right there. But in the home, if someone is coming in that is not within your household, and it's so important that both yourself and whoever that person is also wearing a mask, and do everything you can to increase the airflow within that setting.
Yeah, absolutely. Mm-hmm. We talked about, we always have a live Christmas tree. Mm-hmm. And we talked about, we just have a little tiny enclosed porch, but it's right outside the kitchen. So you would be able to see the sparkling lights on it. We thought about, let's put it outside. It'll force us to go outside more, because obviously in the winter, we're used to staying in all the time. But if, you got a little, heat warmer, or you just bundled up, you go outside, sip some hot chocolate and gather around the Christmas tree outside, you're lessening the chances of spreading being so enclosed. So that, yes. That's opening the windows is normally something I have to do at the holidays, because I'll burn something when I'm cooking. But that is another thing that's increasing this critical risk time, is that we're indoors more, Absolutely. Closed inside, and the air isn't circulating.
So. Yes, that's correct. So anything we can do to increase that airflow, look at even purchasing maybe higher quality filters that you typically have, and maybe you haven't looked at the filters in a while or a few months. Go ahead and get new filters. If you can get the higher quality ones that you can find, that will be helpful. And just really doing everything you can. If you're not able to not have someone come into the home, do everything you can to prevent that, and filters and increasing airflow, and wearing masks. And if you have a space that you can gather outdoors, in not an enclosed environment, but a patio or a porch or somewhere, that would be a better option, in keeping distance, so you can still enjoy those things. It's just, we have to reimagine things.
We do. And a lot of people are reimagining, obviously, holiday shopping. There's many stores that are letting you peruse all their stuff online. And then if you get there, maybe you have an appointment, or they just already have your order ready to pick up, and you can still support a local shop, but yet, and get that unique gift for somebody. But because I think a lot of people's aversion to online as well, it's just, it's everybody's going to get the same gifts. But, a lot of stores are doing that. And we would encourage people to not gather, and not, line up in front of the stores, right? And try to all shop at once like we're used to, that whole thing. Christmas time, and I'm usually last minute, But I'm, I'm with those late, those late folks at the last minute in the store. And I think this year I'm really going to plan. I'm really going to try to, think about who I need to get on my list and go online. And again, a lot of the stores have added, a web presence that they didn't have before to help encourage them and get you those unique gifts.
Right.
So.
Things have been so different. I think we've seen just from grocery shopping to just typical online shopping, and now for Christmas shopping and or holiday shopping, it does look a bit different, but you can still go to some of your favorite places and they're offering curbside pickup, or you can order it from their store and deliver it to your home, and you don't even have to go out.
Yeah.
The concern is being inside of the store and being in really cramped lines and for a long period of time with people that are not from your household, or that you can potentially are unaware of that might have the virus. And so you really want to limit those opportunities for contracting the virus. And so it's so important that you take those measures and use the resources available. So using all the online options, using the drive-up options and curbside delivery. That's been great. I think a lot of stores have really pushed that as this pandemic has continued on.
So one thing we want to talk about too is what happens when I do get that test back in maybe 24 to 48 hours at one of the Wake County locations, and I am positive. I should expect a phone call, right, from Wake County. I think at first I thought contact tracing was this magical, there was like some program that you had and it tracked people and it knew who I came in contact with, but obviously it's not like that. People should expect a phone call from just a normal person that will help walk through who have you maybe come in contact with, right?
Right. So a part of that process is when someone tests positive, then our group will then reach out to them. So someone from our case investigation group can reach out and gather more information. So really understanding where might you have been, what people might have been around you, and all of that information that you provide. If you provide names of contacts, it's done anonymously. They're notified anonymously, so you don't have to feel worried or frightened that they're going to know, oh gosh, it's me. And it's done anonymously. And our case investigators then let our contact tracers reach out to those contacts and provide them with information on what to do. If you're going to isolate for the amount of time that you need to, then they will provide that information. If you have been identified as a close contact to someone that tests positive, then you'll have to quarantine for 14 days. And so they'll provide you with that information and let you know when that will start and when that ends. And they're there as a resource to really help support through that process.
And we really want to encourage people to be open to that. I think, my habit is I'm not going to answer the phone if I don't know who it is. But, participating in those phone calls for your own benefit, for your family's benefit, because that's only going to help to prevent it from spreading even further.
Yes, that's so important. I think everyone should know that this is not being done to be sort of an intrusion on your life or anything like that. It's really it's being done to make sure that we're keeping the community safe and identifying anyone else who might potentially be exposed or that can potentially expose others. And that's the whole reason why we're doing the contact tracing. It is really for protection of the community.
Because right now, one person is infecting another person, and then 2 are turning into 4, and 4 are turning into 8, and that's how we're seeing this ballooning of positivity.
We have community transmission here within our community. So that, it is, you don't know who has it, who doesn't have it, because there's people that do not have symptoms. And so once again, that's why it's so important that you're wearing your mask and you're keeping your distance and washing your hands frequently, because you don't know. And so if you get a phone call from Wake County and their contact tracing or case investigation team, definitely answer that and respond back as open and honest, so that we can do our part as well to make sure that we're protecting everyone in the community.
Absolutely. Well, Dr. Mushonga, I want to thank you so much for joining us today. I hope we have great holidays. They won't look like any holidays that we've had before, but they'll be healthy holidays, and we will get through to 2021.
Yes.
Hopefully. Well, thank you for joining us, and thank all of you for joining us here on WakeTV. We have more information, all this advice on what you can do to protect you and your family, have a healthy holiday, start new memories and traditions, and of course, all that information about testing and contact tracing can be found at wakegov.com/COVID-19.
Since 2009, the Happy Trails program has turned thousands of Christmas trees into mulch for many of the trails in Wake County's parks. We encourage residents to recycle their Christmas trees by bringing them to one of the 8 convenient locations around the county for chipping. In 2019 alone, the Happy Trails program received 6,645 trees, which were turned into more than 114 tons of mulch.
A tree is full of life. We cut it down, we use it for 6 weeks, and then we throw it, and what are we gonna do with it? Well, you can either take it to a landfill and bury it, you can throw it in a pond and make it a fish habitat, or you can bring it to us, we'll chip it, and we'll put it down and use it as trail lay, and hopefully those nutrients will grow other trees.
If you would like to donate your tree to the Happy Trails program at the end of this year's holiday season, please remove all decorations and bring the tree to one of the 8 locations on your screen by Sunday, January 24th.
Having a septic system is great because you don't have to pay a monthly bill for sewer service, but that freedom comes with responsibility. You're basically your own utility company, which means it's up to you to monitor your septic system and set aside money for maintenance. Here are the top 10 things you can do to take care of your septic system. 1. Pump out your tank every 3 to 5 years depending on how much water you use. 2. Clean your filter at least once a year. 3. Monitor your water use to avoid overloading your system. For every bedroom in your house, the septic system is designed to accommodate 120 gallons a day. For a 3-bedroom, that's 360 gallons a day. As a rule of thumb, stay under about 80% of your total capacity. 4. Spread laundry out. Doing several loads in one day can overwhelm your septic system. 5. Keep vehicles off your drain field. Don't drive or park on the system. 6. Don't install sprinkler systems or underground utilities on top of the septic system. 7. In the home, only use products marked safe for septic systems and avoid flushing non-biodegradable materials down the drain. 8. Prune and maintain any plants that grow on and around your drain field. Overgrowth can damage your system. 9. Route gutters and drains to divert stormwater away from your drain field. 10. Don't pour kitchen greases, such as cooking oil and bacon grease, down drains or toilets. Instead, allow greases to cool and scrape them into an old jar or can and that can be thrown away. When that gets full, toss it in the garbage. That's all there is to it. As the old saying goes, an ounce of prevention is worth a pound of cure. When it comes to your septic system, spending a few bucks today could save you thousands in repairs. Don't skimp on routine maintenance. Take care of your septic system and it will take care of your household's wastewater for years to come. To learn more, visit wakegov.com/septic. That's all for this episode of Wake TV. Keep up with the latest Wake County news by visiting us online at wakegov.com/news. And be sure to follow us on Facebook, Instagram, Twitter, and YouTube so you can always stay in the loop. We'll see you next time.